Today I want to spend a little bit of time talking about some of the physiologic changes you can anticipate after birthing your baby. One of the first ones that I get asked about is about postpartum bleeding. Once the baby's out, whether you've birthed vaginally or by cesarean section, you're going to have a period of time where you have some very heavy bleeding that occurs. Some parents like to go out and buy themselves some Depends or some equal type of undergarment that they can just put on, disposable undergarment that they can wear that will absorb some of the blood. Other parents are less comfortable with that idea and decide instead to go with a maxi pad. One of the things that I will encourage you to bear in mind is that the bleeding is happening because the placenta has sheared itself away from the uterine wall. So if you think about the pregnancy, you've got your uterine wall and you've got the placenta right up against it, and the fibers weave together, and the placenta is embedded into the side of the uterus. Once your baby is on the outside of your body, the uterus contracts and it shears the placenta off the side of the uterus, and your body physically expels it. And the wound that's left inside your body is a pretty good size. With the oxytocin that your body naturally produces post-birth, especially with stimulation of the breast tissue by putting baby to the chest and feeding the baby or attempting to feed the baby from your body, that stimulation can have a hormonal response. Many birthing parents are also given a dose of synthetic oxytocin, either intramuscularly in the thigh during the birth process or immediately post-birth in the IV line, that if you have an IV line running. And that oxytocin encourages the uterus to continue to contract, both to shear the placenta, but also to help, because I guess if you think about it, if you had an open wound, on your hand and it was bleeding profusely, you would put your hand over your hand and you'd apply firm pressure, and your hope would be that you would slow the flow of bleeding because of the pressure that you're applying. And we do that with wounds anywhere, but unfortunately this one is inside your body and no one is going to put their hand on it to try and stop the bleeding. So we need the uterus to try and do it to itself by squeezing it tight and contracting it to help slow that flow of bleeding. And it will slow considerably, but over the first few days, week, even up to 6 weeks, that flow of blood will continue. And for some people, it is something that happens for an extended period of time, and they find that if they're fatigued, if they're overexerting themselves, sort of physically walking too much, moving about too much, taking care of other children and needing to meet their needs, and so not able to get enough rest, those kinds of things, maybe not getting enough water, staying adequately hydrated, all of those things can impact how long you bleed for outside of just your own body's physiology. Some people just bleed longer, and that's not abnormal. What we're looking for, though, is the quantity of the blood. Is the blood in large quantity for the first couple of days? And it will be in large quantity for the first couple of days. You'll be changing that pad or overnight maxi frequently over the first few days, and then it'll be get less and less and less. And then towards the end of the 10-day to 2-week mark, and really from then till the end of the 6 weeks, you may notice scant traces of blood, more like the end of a menstrual cycle. And that is perfectly normal. So watch for that. If you notice that you're passing clots and they're any bigger than the size of a dime and they're happening with any kind of consistency, please make sure that you remember to reach out to your care provider, whether it's a midwife, family doc, or obstetrician. Let them know that you're passing large clots. They may very well want you to watch for potential signs of infection, signs of retained placenta. It's uncommon, but it does happen that not all of the placenta comes out. Midwives especially are very good about showing you your placenta when the baby's on the outside if you want to see it, and they'll lay it out in front of you and they'll make sure that they sort of see that there are no obvious pieces missing. Other care providers look, but you don't see them look so much, so you don't necessarily know or have that confidence that they have looked. That I can assure you they have. But midwives actually take the time to give you a bit of a tour of your placenta, because truthfully, let's think about it. It's the organ that your body grows with the sole purpose of giving you a baby at the end. And then your body doesn't need that organ anymore, so it discards it. So I kind of think that they're pretty cool and fascinating, and I think that they're just amazing to look at and to see how different each and every one is, but not everybody thinks the same way I do. So that's okay too. That bleeding after your baby is born is called lochia, and it's normal. But just do, as I say, watch for how much you're bleeding and if there are any clots, okay? And if you're using pads instead, then I encourage you to go with something that is more natural fibers. Natural Care, 7th generation, those kinds of things have unbleached cotton involved and unbleached paper product involved, where many of the other mainstream products have bleach in them. And you're putting that right up against your pelvic floor, and you have an open wound inside your body, and you just don't necessarily want to take any kind of toxins into your body or bleach into your body. It's meant to be on the outside. It's not an internal kind of thing. So keep that kind of thing in mind, because it is about your health overall, right? So lochial bleeding after the birth is very normal, and it is expected. So set yourself up for that. And actually, if you've got pads anyway, what I would encourage you to do in advance of the baby coming is actually take a couple of those pads out, open them up completely, and just put maybe an ounce of water along the middle of it and put that in the freezer. And you may want to put a drop of witch hazel in it as well, and astringent to help reduce swelling and inflammation at the site. That can feel really good. Some people like to put a little essential oil on it. I'm not necessarily advocating for that. I think you want to speak to somebody who is specifically trained in prescribing the use of pure essential oils if you're wanting something like that. But it is certainly allowed if you know what you're doing. But that little bit of water, put the pad in the freezer. We call them padsicles. But those against your bottom after you've birthed the baby can just feel so good. And if you've only put an ounce of water in through the whole thing, even a tablespoon or two is good enough to just give you that cold pack on your bottom, but still have some absorbency left in the pad for the blood that does come. So that's something to think about as well if you're getting pads anyway, you want to just make your pelvic floor a little bit more comfortable after you've birthed. While we're talking about pelvic floor, let's touch on a topic nobody wants to talk about, and that is hemorrhoids. So you're pregnant, you're not evacuating waste through your bowels necessarily as frequently. Make sure you're still getting that at least 2 liters of water a day. And that's really important to help keep your bowels moving. But constipation is so normal with pregnant parents, so it can be common to develop hemorrhoids. So what do you do about it? How do you treat them? How do you make yourself more comfortable? It's not common that people who develop hemorrhoids require the use of Anusol or Preparation H, although some people find that just having that and being able to use it before they go to bed at night, by morning they wake up and things aren't as uncomfortable. Some people actually develop hemorrhoids that are bad enough, especially post-birth, but even prenatally, that they get themselves a little donut or pillow, specialized pillow to sit on so that they have a bit more pelvic floor support around the area without putting direct pressure on the anus, and that can make them feel more comfortable. A lot of people, though, that I meet that talk to me about issues with hemorrhoids aren't suffering a lot. They're just uncomfortable and they don't like it and they don't want to tell anybody else that they've got an issue. And so sometimes it can be something as simple as picking up a container of Tux pads from the local pharmacy and keeping those in the fridge, and after you've gone to the washroom, just taking a couple of those pads and putting them against your anus and just leaving them there for a period of time. They are wet they are witch hazel soaked pads. You will want to put a panty liner on or something like that so your underpants don't get completely soaked. But it is something that can help reduce some of the swelling and inflammation, because that's what makes it itchy and uncomfortable. You can make your own witch hazel soaked pads as well. And I would say that you're doing 5 parts of water to 1 part witch hazel. Really make sure that witch hazel is diluted. And originally, for the first time or two that you use it, take a cotton pad and just dab it in the fluid and then pat that against your anus and see if that helps, because you don't want it to be too strong, and everybody's tolerance level is different. So do kind of be careful with your body for that one. And as I say, those padsicles that I just talked about, making those can feel really good as well to help reduce swelling and inflammation in the area. And truth be told, after birth, if you've had any tearing, or some doctors even still do episiotomies, although very rarely, you may want some of those witch hazel soaked pads and those padsicles, just because the pelvic floor is going to be uncomfortable through stitches as well. So keep that kind of thing close by. It does feel better to be able to have some way of coping and managing that. It can also be helpful to remember that you will be sent home from the hospital with a little, what we call a peri bottle. And it's a water bottle, essentially, a disposable water bottle type of thing with a top on it that has multi holes in it, so that you, before you sit down to go to the washroom, fill that with warm water. You may even want to make a special Epsom salt solution that you put in the bottle that you can spray your bottom with after you've gone to the washroom, whether it's just urination or defecation, it doesn't really matter. Rinsing your pelvic floor with that Epsom salts and Epsom salt water, or even just clear water, can sometimes just feel so much better when your pelvic floor is still feeling a little bit of raw and uncomfortable. All right, so try that. It's easy to do. Again, with Epsom salts, it's a small amount of Epsom salts to a large quantity of water, and mix it up really well, and then you can set that aside. I liked to use warm water because it felt better. Cold water spraying on my bottom felt pretty uncomfortable, quite frankly, especially after giving birth, when the area was already extra sensitive to begin with. But just treat your bottom with some kindness. It needs some time to heal. It is been through a lot, and it will heal quickly. It just needs the time and respect to do that. When does your milk change? Throughout the latter part of pregnancy and through the first couple of days after your baby is born, your breast tissue is full of colostrum. Colostrum is small in quantity, because babies' tummies, remember, at the time of birth, are the size of a cooked chickpea, so it doesn't take much to fill it. It doesn't take much to empty it, but it doesn't take much to fill it. So they don't need large quantities of anything to consume right after birth. And if you were to express colostrum, then you would find it being kind of a goldy color, because it's really high in fats and proteins and antibodies and all the things that we need babies to get. And sometimes if you're expressing, you'd notice a little gold bubble and a white bubble, and there's water mixed in with that as well for hydration for babies. So it is there. And ultimately, one of the reasons I think that it's there, and you sometimes take medicine away from things and just leave basic science and biology. And if our bodies are creating food for our babies that we've birthed, then it stands to reason that we need to figure out how to get that food into the babies. So I feel like that food is small because babies' tummies are small. And I also know that we need time to figure out how to get them to take that food from our bodies if we're feeding from our bodies. So it's actually a bit of a relief that the milk doesn't come in until your baby's 2 or 3 days old. After cesarean section, you can definitely assume that it's going to be 72 hours, but even after a vaginal birth, it can sometimes be about 3 days. It really depends on if this is your first baby, if this is like a second or subsequent baby. It does take some time to kind of have your body settle into the new normal of not being pregnant anymore. And then your milk starts to change. And over the next couple of weeks, it's transitioning from colostrum to what we call mature milk. And the mature milk is made up of foremilk and hind milk. The foremilk has a higher water content, lower fat, protein content, but within seconds of babies going to the body to start to feed from the body, that foremilk starts to make the transition to hind milk. And the hind milk has more fats, more proteins, more antibodies in it. It's almost like the foremilk quenches the thirst so that baby's really ready to have a big dinner while they're eating. But that first few days, there is some changes that need to take place. So have your baby on your body as frequently as you can to help make sure that they are as comfortable with getting food from your body as you are from them getting it from your body, and also help set that pattern for milk production. A lot of parents that I meet say that their hair was falling out in clumps during pregnancy, and they're terrified that they're going to be bald by the time their baby's 6 months old, only to find that shortly after the birth, the hair is no longer falling out in the same quantities. On the other side of the coin, I have some parents say that their hair's never looked better. It's never been more thick and lush and full than when they were pregnant, only to find when their baby was about 4 months old that their hair started falling out in what felt like clumps. And it's just part of the hormones of the process. And your body's going to level those numbers out and that amount out over time. But it's going to be disconcerting regardless. So usually by about 4 or 6 months postpartum, your hair levels are starting to regulate a little bit more. If you've lost lots during pregnancy, then you're going to notice by about 4 months you've got little sprigs starting to fill in. But it will sort itself out. But hair is a really common thing to have affected by pregnancy, so don't be alarmed by it. That's pretty normal. When can you start having sex again? That's a pretty good question. If you're wanting to have sex again, it is generally recommended that you wait for any kind of penetrative intercourse to have your 6-week postpartum check first. And that's just to make sure that everything's healing well, that your body is starting to get back to its old self in terms of the cervix being closed, the uterus laying where we want it to, the stitches healing, hemorrhoids healing, all of that kind of thing. So it isn't that we're worried about a whole lot of things. It's just about giving your body some time. That doesn't mean you can't have orgasm, and certainly you're welcome to do that if you have the energy to do it, quite frankly, because in the first couple of months you're going to be tired because you're going to be busy with your new baby. But if that's what you want for yourself, either with or without your partner, then by all means go ahead. But as I say, it's really truly only just non-penetrative sex that's okay until you've had your 6-week postpartum check and get the all clear from your care provider. If after 6 weeks you are choosing to have intercourse and you are having intercourse with someone who can impregnate you, then it's really, really important to use a barrier method for birth control. So pick some up. Yes, when you feed your baby from your body, it does affect your hormones. And generally speaking, if your baby is getting all of their food source from your body, at your body, on your body, then your body should theoretically be suppressing estrogen enough that it's unlikely that your body will ovulate. But that's not a guarantee. And it's pretty common in my experience that the people who can ovulate don't generally or often know what signs of ovulation are. And if you don't know what the signs of ovulation are, then it's easy to miss them. And that's why all too often I hear somebody say that they were, their baby is 6 months old. They've been feeding their baby from their body since the baby was born, and they're pregnant again. And they say, but I didn't even have a menstrual cycle. Well, in the age-old question, which comes first, the chicken or the egg? In my opinion, it's always the egg. Because remember, ovulation is what triggers and stimulates menstruation. So just because you haven't bled yet doesn't mean that you can't get pregnant. The pregnancy opportunity presents itself typically a couple of weeks before you actually menstruate. So watch for those signs. And if you need to, take some time to learn what the signs of ovulation are so that you can be ready. Okay? But a barrier method like condoms can be really effective. I don't generally recommend the birth control pill, and that's primarily because I'm concerned about estrogen levels in the pill, even progesterone only pills, because they can really mess with hormones if you're feeding from your body. So if you're not feeding from your body, then by all means return to whatever birth control method you feel most comfortable with. But do keep in mind you do need to find a birth control type that works well for you. When can you go back to exercising? Well, it's important to remember that you're still going to look about 6 months pregnant after your baby's on the outside of your body, and it'll take some time for that to come off. Remember, it took 9 months to put that on. It's going to take probably close to 9 months for that to come off. But if you're wanting to exercise, then really give yourself, after a vaginal birth, a good 6 weeks or more before you get into too many activities that engage the core too much. You want to give those muscles time to not feel like they're supposed to be supporting the uterus and the weight of the uterus. You want to give those muscles time to come back together a little bit before you start trying to really tone them. That doesn't mean that you can't do cardio and you can't go for good walks and be active. You certainly can. When we're talking about crunches and pull-ups and things that can really engage your core, I do encourage you to just wait until after your 6-week postpartum visit and just get the okay to do that your body is bouncing back the way that you want it to, so that you can start engaging those core muscles to really tighten things up again. That includes free weights and stuff like that as well, but basic cardio aerobic activity is fine and is encouraged. You might as well stay busy, stay active, go for walks with your babies, go for gentle runs with your baby when you feel up to it, as you feel up to it. But make sure, especially in the first month or so, that the energy you're expending is also energy you're conserving. So if you go for a bit of a run with your child, when they nap, when you get home, make sure you hydrate well and then lie down yourself, so that you are resting, so your body can still continue to recover, because it hasn't been sick, but it's done a really, really hard job by giving you another human being to look after. If you have any questions, comments, or concerns, please don't hesitate to leave a comment in the comment section here. Email me at babyreadylgbtq@gmail.com, or visit my website and leave a comment there, www.babyready.info. As always, I'm going to ask you again to please subscribe to this page and share it with all your friends and family who are having babies or are thinking about having babies and wanting to make sure that they knew what resources are available to them once the process gets started for them. Have a wonderful day. I'll talk soon.